For women hoping to bring a little bundle of joy into this world this year, there are several things they can do to increase their chances of having a healthy baby. Here to explain the importance of prenatal preparation is Dr. Lisa Masterson, OBGYN and former host of the TV show The Doctors. So Lisa, why is it important for a woman to talk to their healthcare provider before she gets pregnant?
Well, before is the key, because then she might be able to get a preconceptional consultation and really find out what's going to be the best for her individual needs and get a personalized plan for before, during, and after her pregnancy. So important, because birth defects happen before a woman a lot of times even knows she's pregnant. And we know that about half of the pregnancies in the United States are unplanned, or unplanned. So it's really important for a woman to know that, so that she can, find out if she needs to take more prenatal vitamins, or if she hasn't, then she should take it, at the very least, a multivitamin with folic acid. Because the CDC and us gynecologists, we really strongly urge women, all women of childbearing age, to actually take a multivitamin with folic acid, just in case they happen to get pregnant and didn't know, so they'll be covered for early in the pregnancy when birth defects like neural tube disorders happen.
Good. So are there any other important steps a woman can take to increase her chances of having a healthy baby?
Oh, absolutely. She can talk to her doctor about what she should eat, healthy eating. And that does not mean eating for two. That means knowing which foods that you should eat and which foods to avoid, like unpasteurized food or raw foods. So and also maintaining a healthy, active lifestyle. Exercise is actually really important to a healthy pregnancy, and knowing which things that you should do and should not do. And then again, knowing to continue your prenatal vitamin through pregnancy. It's just as important during pregnancy as well, because with a pregnant woman, you can't tell. It's so important how much of a vitamin that she gets, because these are going into the building blocks of the baby, that you can't determine that just by diet alone. So it's really important that she actually continue her prenatal vitamin, and as well as other nutrients during the pregnancy.
Interesting. So what nutrients are most important during pregnancy, and why?
Well, calcium is really important, just like, the calcium for your own body and bones. It's important in building that baby's bones. Also iron, because a woman's blood volume actually doubles during pregnancy, and those carry all the nutrients. So iron is extremely important, as well as vitamin B12. And actually, she may need more folic acid than the standard dosage if she's at a higher risk for neural tube defects. Say she has diabetes, or she is obese, or has inflammatory bowel disorder, or disorder that causes malabsorption of certain nutrients, then she may need an actual higher dosage than is in usual prenatal vitamins. And that's why I'm so thrilled today to be here with Duchenet USA and be able to talk about Emterity Folic 5, because it does have a higher dosage, and it's really, really, really so important. And a lot of people know about taking folic acid to decrease the risk of neural tube defects, but they don't know if they're in a higher category where they need even a higher dosage, and then what's available to them out there. So not all prenatal vitamins are created equal, and women need to know, what prenatal vitamins to take if they're lactose intolerant, or if they have a gluten intolerance, or if they have to follow certain religious dietary laws, that there are different prenatal vitamins out there, or say they have nausea and vomiting in pregnancy and don't want to take those big pills but want to split into an AM and PM dosing. Emterity, they think about all those things, and that's one reason why I think they're a wonderful prenatal vitamin.
And finally, what resources are available to help a woman who is considering getting pregnant this year?
Well, if she goes to Emterity.com, she's going to get a whole bunch of prenatal, get information about pregnancy and prenatal vitamins. And then always, 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 she should consult her healthcare provider to help guide her through her pregnancy.
Awesome. Thank you so much for joining us this morning with Dr. Masterson.
Thank you so much for having me.